With Zion Health, our members are responsible for a small portion of any medical expense before the community will share costs related to a medical need. This member responsibility is called the Initial Unshareable Amount, or IUA. Our members can choose between 3 different IUA amounts depending on their budget. Once a member has paid their IUA, the rest of their eligible expenses are shared by the community. Here's how the IUA compares to a traditional insurance plan in a real-life scenario. This is Tim, a member of Zion Health. Eric is on a traditional insurance plan. Tim and Eric both fall while playing basketball at the community park and end up with fractured ankles. Tim goes to the emergency room. He receives a diagnostic x-ray, has his ankle wrapped, and is told he will need surgery. Eric also goes to the emergency room for the same treatment. The emergency room bill totals $2,500. Tim opens up a need with Zion Health. He is responsible for his $1,000 IUA. After that, the Zion Health community shares the rest of his eligible expenses. Eric has a $500 copay for his emergency room visit, and insurance then pays for the rest. Tim and Eric both then get surgery on their ankle the next day, which costs $20,000. Because Tim's already met his IUA, Zion Health shares in the full cost of the surgery. Eric has a $5,000 deductible that he has to pay for his surgery before insurance will cover anything. After that, he has 20% co-insurance, which brings his total expenses for the surgery to $8,000. Both men have 2 follow-up visits with their doctor to make sure that their ankles have healed. Each visit is billed at $200. Because the visits are part of the same need, the cost of Tim's visits are shared with Zion Health, and he doesn't pay anything more. Eric has a $25 copay for each visit. Finally, both men need 10 sessions of physical therapy, billed at $150 each. Tim has paid his IUA, so these visits are shared 100% based on Zion Health's member guidelines. Eric has already met his out-of-pocket max for the year of $8,550, so he doesn't pay anything else for those visits either. The total expenses of these services without either insurance or Zion Health amounts to $24,400. With Zion Health, Tim paid $1,000. Because all the costs related to the same need, everything was shareable after his IUA. Using traditional insurance, Eric paid $8,550 for the same medical services. With insurance, the initial emergency room visit cost less, but deductibles, co-insurance, and co-pays for each visit still added up until Eric reached his out-of-pocket maximum, which is far greater than a Zion Health IUA. The IUA is paid per need, meaning members will pay an IUA for each medical incident. So, for Tim's ankle, including all the follow-up treatment is an example of a single medical need. If Tim got sick then and was hospitalized, that would be a new need with a new IUA. Members of Zion Health pay a maximum of only 3 IUAs per 12-month period. If Tim and his family had more than 3 needs in the space of a year, their needs would be shared without having to pay another IUA. Zion Health's Initial Unshareable Amount system saves members money when they have large medical expenses. To learn more about sharing a need with Zion Health, visit zionhealth.org.